Hi, I'm Grant Mukai here at Wellesley Media, and we're pleased to welcome Dennis Sullivan. He has over 25 years of experience at his law firm here in town, Dennis Sullivan and Associates. And we're here to talk about his book, which came out earlier this year. You know, with the many changes that have been happening recently with healthcare reform, many seniors and boomers are concerned with how these changes are going to affect them. So this book talks a little bit about how to avoid rising long-term costs while protecting your spouse, home, and life savings. So
that's right, Grant. We've actually been helping clients for a number of years, but especially with the new Healthcare Reform Act, never before have seniors and boomers and their families been as concerned as they are now about what it means for them and for the future. So we worked over 6 or 8 months or so while the Healthcare Reform Act was being put together to monitor the changes so that we come up with information for the book. But it was delayed a little bit with the result of the tax reform that passed on January 1st of this year. So we took a little bit of extra time to explain some of the new provisions in the book on tax increases, as well as some of the changes such as with the membership panels. And a lot of that is discussed in the book.
now, Dennis, with all the financial problems in this country, what does this mean for our health, Social Security, finances, and our lifestyle?
Well, Grant, what concerns many senior and boomers is the health and security benefits are going to be drastically reduced. $716 billion in savings has already been promised as cuts as part of the Affordable Care Act. While it's being suggested that these savings are going to be achieved by identifying overpayments, including fraud and abuse in the Medicare payment system, the changes are also causing hospitals to be a lot more stringent in determining who does and doesn't qualify for services. In fact, that requires a determination by the hospital administrators as to whether someone's admitted on either an inpatient basis or for observation status. Now, this is very important, and that's going to affect the Medicare qualification procedures as well as the amount of the Medicare copayment. Now, I know we're all in favor of a sound healthcare system that provides exceptional care in an effective manner for seniors. But what's very concerning is that well-intentioned changes in the Medicare system might result in seniors not getting the quality of care or the quality of service that they otherwise be entitled to. So we're very hopeful that safeguards will be put in place so that the quality of care does not suffer in an effort to reach the targeted $1,716 billion in savings put forth by the Affordable Care Act. For people to learn more about these changes and more, you can order the Senior and Boomers Guide to Healthcare Reform and Avoiding Nursing Home Poverty online from our website, dsullivan.com. We also have a limited quantity available for Massachusetts residents over the age of 50 that can be ordered also from our website, dsullivan.com, or by calling our office at 781-237-2815.